From Montana's news leader, this is the MTN 530 News.
Good evening, everyone. Thanks for joining us. I'm Jeanelle Slade. Tonight, as COVID numbers skyrocket, we hear from Billings hospital teams now preparing for the worst. Hospital beds are nearing capacity as the county's infectious rate is already threatening to hit the threshold to start shutting down local bars and restaurants. Tonight, another urgent plea from health officials and also from business owners for people to do their part to prevent the spread. The Billings Chamber held a virtual town hall this afternoon where a lot of details came out. Q2's Russ Riesinger joins us now with more. Russ.
Well, Jeanelle, I believe this was probably the most sobering assessment yet of just how serious the situation is becoming and what could lie ahead in coming weeks right here in Yellowstone County. Business leaders got an update from County Health Officer John Felton, Billings Clinic CEO Scott Elner, and others as they talked about steps that they say must be taken and now to ensure the health of both people and businesses. The way we're headed right now with the numbers, businesses could very well be forced to reduce capacity to 50%, not the 25% Felton said earlier this week. But even that would be devastating. The situation's also becoming dire for our hospitals. Take a listen to some of what was said.
There's so many businesses that we do business with that if we're not in business, they're out of business as well. So we really got to do our part to keep things together because we can't afford to go backwards. There's no programs left, run out of time, run out of money. And I know right now there's going to be a lot of restaurants that aren't going to make it to the end of the year under the 75%. So we go down to 50, we go down to 25, they're not going to make it.
I think until you've had a loved one, family member, friend, or yourself go through this, you don't realize how bad it is. It's about as serious, if not worse, than what we saw with the HIV crisis back in the 80s. And people just don't know how to react. People are scared. Our health caregivers are scared. They're worried that they may contract the virus.
Dr. Elner says they're expecting 150 to 200 more hospitalizations in the next 2 to 4 weeks if things keep going like they have. They've even ordered what's known as a reefer truck. That's a refrigerated truck where bodies are stored. So it kind of gives you an idea of just how serious this is all becoming. The Chamber is asking all businesses to take a pledge to have as many employees as possible work from home, something we are doing here at Q2 in order to try and lessen the spread. About 50% of all cases do come from the workplace. Jeanelle?
All right, thanks so much, Russ. Well, County Health Officer John Felton announced this week that the rate of infection in Yellowstone County is unsustainable. Today, the 1 week average of new cases per 100,000 people stands at 41. Now, if that number stays above 40 by the end of the month, there will be reductions on restaurants, bars, and other areas where people congregate. Well, today, hospitals across the state released their current capacity and bed numbers. That data shows St. Vincent Healthcare almost full and Billings Clinic not far behind. St. Vincent is showing it has 45 COVID patients. 9 of them are in the ICU, while Billings Clinic reports 43 COVID-19 patients. 18 of them tonight are in intensive care. Well, both Billings hospitals have their own COVID-19 protocols, and so far, they've been able to handle the increased need for medical help. Q2's David J. touched base at both facilities today.
Here at Billings Clinic and over at St. Vincent Healthcare, they're seeing an increase in COVID-19 cases. We had a chance to talk with doctors from both hospitals about how that challenge is going in treating patients.
The care that the patients are receiving continues to be exceptional. The staff are stretched. They're working incredibly hard. You can feel the strain based on how sick the COVID positive patients are here at our clinic. One thing I will say is that people are working together. They're working collaboratively in order to find solutions in order to meet the needs of the patients when they come in.
It's definitely put a stress on everybody. It's put a stress on us, somewhat emotionally from, handling all the new cases and seeing all these sick people. From a resource standpoint, sure, it's stressing us, but I think we're handling things well. We've had some amazing people working to come up with what are our contingency plans when these numbers do hit this.
I will say that it does matter out in the community if patients are masking And if people in the community are following the guidelines, it does help with easing that burden of patients coming to the hospital.
Because the numbers are blowing up like this, it's starting to touch everybody. I think just about everybody's got a close friend, family member, coworker, somebody's getting sick.
It's important to follow the protocols, not just for COVID patients, but for everyone who visits the hospital. Jeanelle?
All right, thanks so much, Dave. Now, both hospitals have been able to tap into their networks of hospitals, and St. Vincent has brought in nurses from Colorado who have already dealt with the COVID peak there. Well, state health authorities announced 615 new confirmed COVID-19 cases today as the state death toll reaches 206. The latest confirmed death reported out of Yellowstone County this morning. The state's largest county now reaching 70 deaths total. Missoula County reports 106 new positive cases, followed by Flathead with 98 and Yellowstone County in third with 88. There are now nearly 5,600 active cases across the state, and more than 11,000 Montanans have recovered. Well, the U.S. Supreme Court on Thursday rejected a last-minute effort by Republicans to halt all-mail voting in most of Montana's counties for the general election. That means the 45 Montana counties will be mailing ballots to all registered voters starting on Friday. The other 11 counties will have polls open on Election Day, but will still be mailing absentee ballots. Montana Republicans and the Trump campaign filed suit to overturn Governor Bullock's order that allowed all-mail voting during the pandemic. A federal judge in Missoula ruled against them last week, and the Supreme Court agrees. Well, ballots for the November 3rd general election, get mailed out tomorrow. Yellowstone County Elections Administrator Brett Rutherford says be watching for those ballots arriving as soon as Saturday or early next week. Now, keep in mind, however, Monday is Columbus Day, a federal holiday, so no mail service on Monday. Rutherford reminds voters who may have moved or have a new mailing address that their ballots cannot be forwarded.
So if you have moved or your mailing address has changed, you do need to notify the elections office. Telling the post office you've moved will not suffice. We have to have written permission to send a ballot to a new address from the voters themselves. You can check your status on the My Voter page at votinginmontana.com or on any of the county election websites. That's probably the easiest thing for people to do if they're not sure if they've updated their information.
Now, a couple of dates to keep in mind. October 26th is the close of voter registration. After then, late registration must be done in person. The deadline to get your ballot back to the elections office, 8 p.m. on Election Day, November 3rd. If you're mailing in your ballot, Rutherford advises putting it in the mail at least 1 week before Election Day. Ballots can also be dropped off in person at the elections office or at the courthouse or at the elections satellite office, now open at the Montana Pavilion at Metro Park. Now, you can check your voting status and track your ballot on the My Voter page at www.votinginmontana. Up next on tonight's MTN 530 News, we go inside Montana's U.S. Senate race and take a closer look at the hot topic of health care. Plus, it's the Pink Patch Project. Find out how it's supporting breast cancer charity.
And coming up in weather, it was a hot one again today, but we do see some relief right around the corner. We'll talk about it coming up.